And here we are outside the GSR hospital. This is the building itself. It's on 4 floors, ground floor, first floor, second floor and third floor, with an area at the top additionally. To enter into the main door of the hospital, into what is called the waiting area. This is where patients and their parents come and wait for either consultation appointments or to have their children registered for surgery. It's Monday morning, so it's always quite busy on a Monday morning, and this is quite typical. Lots of people waiting to be seen by the doctors or to the reception area where all the administration is done. On the wall here you'll see there are some photographs on the wall, and these are photographs of some of the very many children who've been operated on here at the GSR hospital. And this consists of one large room and a small room beyond where the patients are seen. There are no patients there at the moment, but that is where they are normally seen. To a reception area off the main hall where some of the computer work is done, and just off there is a very small room where all the photography is done. As each child is admitted into the hospital, lots of photographs are taken before, so that a comparison can be done with photographs taken after the surgery. Walked up the stairway onto the first floor, and here we have some of the private wards. The GSR hospital runs on a system of providing free surgery for any child or family that cannot afford the care that they require. However, Dr. Raj and Dr. Gosler do perform some private surgery, and this money from the surgery goes towards paying for the upkeep of the hospital and providing free surgery for those who can't afford it. The second floor contains the 2 operating theatres and the intensive care unit where all the patients go for a short period of time after the surgery has been completed.
Intensive care, it's adjacent to the operating theatres, which are just round here. It's 6 beds. Most of the patients are out within 4 hours, and if they're not, then they are kept longer as required. With Professor Gosler scrubbing up for his next patient, which is what are you doing, Gosler? Unilateral complete cleft lip.
On the 3rd and top floor of the hospital, this is the general ward, and this is where all the patients, a large proportion of whom are the children, go after they're signed off from the intensive care unit, and they stay here for approximately 2 to 3 days following their surgery, depending on how quickly and well they recover. And we're looking here at a little girl who seems to have recovered very well from her surgery and is enjoying life and crawling around. There are 32 beds in this general ward, so while focusing in on the brown and cream-coloured tall building, which is where 71 children from the Cleft School project live as their home during term time. We're now inside the building, and we're just walking into the big ground floor area, which is the communal area where the children play on a Sunday, do their homework during the week, and generally congregate. If round, and there are the children all sitting very quietly, very quietly. It's Sunday today, so they're not at school, and they're all wearing their Cleft Project uniform. The girls wear pink and the boys wear green, and they're all looking very smart today. And we see in the corner there's a cabinet, and it's a very small cabinet, and that houses the children's library. There are a few books in there for the children to read and to learn. Most of them are in English, but some are in Telugu. their native tongue. Children follow a strict regime of yoga and exercise yoga every morning between 5 and 6 o'clock, Monday to Saturday. They seem to enjoy it, they're very skilled at what they do, they take a lot of pleasure in keeping supple and keeping their minds and bodies in trim. Going to demonstrate the yoga. Is it going to demonstrate the yoga?
Vrishikasana.
Wow, look at that. I think that's quite extraordinary. How fantastic. Well done. Flight of stairs, and we're on the boys' dormitory floor. This is boys' dormitory number 1, and here we have boys' dormitory number 2. And we're just going to go and have a look inside boys' dormitory number 2. And here you will see the children sleep on bunk beds. Each child has its own bed, they have a sheet, they have their own towels, and as you'll see, between the 2 beds there's a wardrobe in which they can keep their personal belongings. If we just move over to here, you'll see that each child has its own plate and its mug, and that they're all kept neatly here, and these are their water bottles. We can also see their school bags. The school bags are provided by the project, and obviously we're just about to enter the floor with a girls' dormitory and a boys' dormitory. So let's go into the girls' dormitory, which again looks very tidy. And here, this is quite a large room. Corner are all their plates and cups. As I said before, each child has its own plate and cup, which they take up to the top floor when it's time for them to eat their meals. An extraordinary area. It's basically we're on the roof. And here is where the 3 cooks prepare all the meals for the children, their breakfast, their packed lunches, or lunch here on a Sunday, and then their evening meal, plus snacks when they come in from school at about 5:30, 5:45. You'll smiles, they never stop smiling. And when you think, it is of course really important for Arwind to have the remaining surgery done on the soft palate at the back, because surgery will be done at the GSR hospital as it has been done with all the other children here at the Cleft School project, and of course it's done entirely free of charge. I think that could be called the smile that would melt 1,000 hearts.